from the VA, and we'll be monitoring the chat as always for any questions you have or comments you have for our guests. And once we are linked to all our platforms, we'll officially get started. In the meantime, just hang tight for those of you listening to ones that are live right now. Great. Okay, the linking has worked. So we're going to go ahead and get started here in about 15 seconds. Hi, welcome back to Coach Connect. Here's where we explore the stories and strategies and insights from trailblazers who are transforming the world of coaching and well-being. What drives their success and what fuels their passion for helping others? We're here to uncover their secrets and share them with you. This show is brought to you by Vibely.io, the all-in-one coaching platform designed to empower coaches with tools, resources, and support we need to thrive and help our clients achieve meaningful, long-lasting growth. I'm Dr. Diego Salinas, your guide on this journey. As a neuroscientist, physician, health coach, and co-founder of Vibely, I'm committed to celebrating the incredible work of coaches everywhere and helping them unlock their full potential. So let's dive in together to see what makes coaching a powerful force of change. Our first guest today, Sara Noyes, is a national board certified health and wellness coach. She's assistant specialist at the VA Office of Patient-Centered Care and Cultural Transformation. She provides national leadership for integrating health and wellness coaching into interdisciplinary clinical teams, establishing health and wellness coaching as a cornerstone of the VA's whole health system. Sara's led initiatives that have enabled over 400,000 health and wellness coaching encounters in 2025, created frameworks, education, tools, and processes that improve veterans' health outcomes and care experiences. She's also spearheaded workforce development efforts, equipping VA staff with coaching skills to foster a culture of collaboration, empathy, and whole person care. She's a recognized leader in systems redesign, policy implementation, and healthcare innovation. Sara's published and presented extensively on best practice in health and well-being coaching and whole health transformation. She holds a master's degree in healthcare management systems and certificates in change management and Lean Six Sigma for healthcare. Our second guest today, Dr. Jenna Clark, is an integrative and family physician certified through the American Board of Family Medicine. Her work and current clinical interests include chronic pain recovery, health and wellness coaches and clinical care teams, and interdisciplinary clinical therapeutic education for chronic disease management and recovery. Dr. Clark leads the Integrative Health Coordinating Center and Whole Health Clinical Care Services as a senior leader for the National Office of Patient-Centered Care and Cultural Transformation in the Veterans Health Administration. Prior to joining as the OPCC NCT as physician leader, her VHA faculty roles were as Associate Chief of Staff, Clinical Director of Whole Health, Pain Clinical Physician Lead, and the Medical Director of the Therapeutic Lifestyle Clinic at the Iowa City VA Healthcare System. She has served veterans in the VA for 19 years. Dr. Clark and Sara, so happy having the podcast. Thank you for being here and helping spread the word of the magical work you guys do at the VA.
Yeah, thanks for having us. We're really excited to talk today.
Yeah, so we have a big episode today. And I know I've read your both bios. Before we dive into working in the VA, people always like knowing a little bit of that origin story, kind of what got you involved in helping others, what led you to this path that you're on here today. So I don't know who wants to go first, but I'd love to hear a little bit in your own words how you ended up here and what drove your passion for helping others.
Sara, do you want to kick us off?
Sure. Yeah. Thanks for this question. I feel like every time I kind of get a question like this, I smile because I'm reminded of the journey and the many people kind of that influenced this journey that I've been on towards health and wellness coaching. And I always knew, even from a young age, I wanted to work in healthcare. And during my graduate studies, I found myself really drawn to the health systems work, really the systems that are behind the care, how processes are shaping the experience of both the patient and the clinician. So that led me to pursue the master's degree in healthcare management systems. And then early in my career, I focused on innovation, things like process improvement, Lean and Six Sigma, systems redesign, and change management. So I was often found myself, involved in pretty complex projects that required us to look at care through both a clinical lens and the patient's lived experience. But it wasn't until I stepped into a role as patient advocate supervisor that something started to click for me. I began to see very clearly how much the traditional healthcare model really lacked space for patient autonomy, for choice, and the patient's own voice. So that realization led me to kind of explore integrative health approaches. And then eventually I joined the Office of Patient-Centered Care and Cultural Transformation. I started my work in the Integrative Health Coordinating Center. And that was where over 10 years ago, I got my first experience with health and wellness coaching. And it was, we were just testing things out. We're seeing where things were going to land at that point. We held a vision aloft for coaching, where we are now, but we were just getting our feet wet with introducing coaching. But for me, what drew me in were really those communication skills that I learned, those coaching skills. And these were the skills that didn't just change how I worked, but they changed how I showed up for people in my life, and quite honestly changed my entire life. So I listened, I learned to listen more, reflect more, create conversations that really were helpful in terms of uncovering individual strengths. I completed my board approved program, and that's where I learned more about the coaching process. And at that point, I think it became clear to me that this is the approach. This is essential in the future of healthcare. And so here, 10 years later, I sit with you and Dr. Clark on this podcast. And it's such an honor to be involved in this work, to support the coaches in the VA that are working hand in hand with veterans. And I'm grateful for really every step that brought me here.
Give me goosebumps, Sarah. That was so heartfelt. Dr. Clark, I could also share, if you could share us your story of how you got here and helping veterans in this way.
Yeah, thank you. And thanks again for having us. So it's hard to believe I'm approaching, 3 decades in my career as a physician. And throughout my career, I've really had the privilege to work with populations that are so deeply impacted by health-related social needs, with medical challenges deeply impacted by health behaviors. And that's true for everybody, but there are some populations that are, that it's so critical to their care. But more important, over the course of my career, the folks for whom diagnosis-focused care, that really, when one envisions like an inherently passive approach to care, it doesn't optimally serve many of the medical challenges our patients come to us. And of course, we're in the VA, so the veterans that we serve, when we look at chronic disease and we look at chronic symptoms, the language and the lens for optimal care has really evolved. And it's very different than many clinicians might have received in their training, right? So my work over the course of my career has been, in obstetrics and in primary care, but then I've done a ton of work in musculoskeletal medicine, which led to work in chronic pain. When my work in chronic pain has led me to develop a therapeutic lifestyle clinic for all chronic disease and chronic symptoms. And so for me, when I became involved with the VA's whole health transformation, really this huge cultural shift that Sara was alluding to, the conversations that I would have as a physician with veterans about why active management of their pain is so important, that leads us to, we actually have to have conversations that are about uncovering forgotten strengths of their spirit, right? And leaning into community and leaning into purpose, what that individual veteran values, what matters most to them. But also in the pain world, doing a lot of therapeutic education to help folks understand, just for example, where does pain come from and how can I impact my own nervous system to move toward recovery, right? This work really leans into someone beginning to understand that, for example, if they have diabetes and a family history of diabetes, that their genes aren't a medical destiny that are written in stone. Or if you have, chronic back pain, that what shows on your MRI isn't this immovable pain destiny, right? That's when the world of recovery really opens up. So this work really led to working in the Office of Patient Centered Care and Cultural Transformation with health and wellness coaching to support these paradigm shifts that are so necessary to happen within our care, in the way we walk the path and hold space for a process of recovery with veterans, especially for medically complex patients. That's what really led me into, first of all, just being so passionate about the work of whole health in VA, but also about the coaching work, because we really have the opportunity to not only bring, as Sarah so beautifully said, like to bring the coaching work into VA, but how do we teach clinicians and teach clinical teams how to imbricate coaches into their care, right? So our honor and privilege is really to bring that process of recovery to people who would lay down their lives for us. So we take this vision very seriously. And so yeah, I've also shared Sarah's affection for the journey, because it's been incredibly meaningful, and we feel so fortunate to be in the VA, serving veterans and helping to bring this work forward.
Yeah, man, so much there. You said forgotten strengths and bringing it out of them. I think in general, as human beings, that negative bias we have, we think about the negative so easily, and that's what comes to our awareness. And we often forgot the strengths that we've built, right? These strengths weren't God given; they were kind of built, and we can also build new strengths to rewrite that destiny. You're saying, right? Your genes aren't written in stone. That strength building, remember that we can do it again and create that self-efficacy. And I see that the passion all three of us share really is systemic change. We see when something can work one-on-one, how do we unlock this to one to many, or really create change that's meaningful to the population? And really the VA is the leader in this in terms of most health coaches employed. And you guys were very fundamental in creating our research. So for those who aren't as familiar, how do some health and wellness coaches operate in the VA healthcare system? If you can give us some insight to how this whole care model works under the VA.
Yeah, I'm happy to kick that one off, and definitely welcome Dr. Clark's input as well. So when we think about the complex health needs that many veterans face, it's so important for us to remember the incredible lives that they've lived and the strength that they've drawn upon again and again. Often in many ways, many of us can hardly even imagine. And so one of the things we emphasize in health and wellness coaching within the VA, and obviously something that aligns really well with positive psychology, is really this idea of capacity. And you alluded to a little bit of it already, Dr. Salinas, around strengths, but capacity really is a blend of the person's strengths, their internal resources, external resources, as well as the interests, their purpose, the things that kind of light them up or keep them going. And so when we think about the veteran population, they bring tremendous capacity to the coaching process through lived experiences. And even if they don't always see it in themselves at first. So our role as health and wellness coaches is to help them really reconnect with those capacities, with those strengths, those moments of perseverance, of courage and resilience they've applied to their life, and sort of elicit those and support them in applying them to their health and well-being goals. This is the heart of coaching. I think all the coaches on the line are probably, feeling tied to this type of work. We hold this belief that every veteran has powerful resources that they can draw on as they move toward their vision of an optimal life. And what veterans are often telling us is that what matters most wasn't the tools or the process or the strategies the coach used. It was really the experience of the coach's unwavering belief in their ability to heal, grow, and make those meaningful steps forward, that unconditional positive regard. So working with veterans means hearing story after story of incredible strength in the face of extraordinary challenge. And that only really deepens our respect for their capacities and their strengths as we work with them. So with that kind of foundation, coaches are partnering with veterans who are living with long-term health conditions, as Dr. Clark alluded to, some of them with ongoing symptoms. So the coach's work is really supporting them in creating goals that are rooted in what matters most to them, their mission, their aspiration, and their purpose. In the VA, we call that their map. We know as coaches that takes some time to really elicit from individuals. So, it's important that we're nurturing the partnership along the way, helping veterans feel seen and supported, building that trust and rapport. I can share a little bit about the coaching process, not going to get too deep, and would love to hear Janet's perspective, Dr. Clark's perspective on the coaching process from a clinician kind of lens. But so the coaching process in the VA, really a journey. Maybe we can consider it sort of like a recipe as it unfolds in a few clear stages. The stages are based on research about what we truly understand. That's what supports lasting growth and meaningful behavior change. And within the VA, coaches are using a 4-stage approach. It's designed to help veterans kind of move toward their personal health goals in a supportive and empowering way. Like I alluded to earlier, the center of that process is what matters most to each veteran, their map, their mission, aspiration, and purpose, as well as the values that are guiding them in their day-to-day life. So coaches are focusing on the practical strategies for behavior change and self-care, and partnering with veterans along the way. Coaches are also in the VA, they're working alongside clinical care teams. They're supporting clinical care, supporting veterans really as they address lifestyle and wellness needs in their day-to-day lives. Together, clinical care and the coach, really, they create a more whole person, veteran-centered approach and support goal attainment as well as goal sustainment along the way. Dr. Clark, would love to kind of hear from you and your clinical perspective in your work with health and wellness coaching.
Yeah, I mean, for me, Sara and I use the word recipe a lot, and it's actually a word that I used in patient care a lot, particularly in the world of chronic pain and chronic disease, and even especially when folks have the intersectionality of multiple chronic medical conditions. How diabetes, for example, struggles with one's diabetes impacts mood. And a veteran's depression or anxiety, and how that in turn impacts their pain, and how their pain impacts how much they can move, which then impacts their diabetes. And so how a few medical conditions can really reinforce the challenges, where it's like a 1 + 1 + 1 makes 72, right? There's so much reinforcement there with the intersectionality of multiple challenges. So that word recipe, we talk about a lot. And when we think about clinicians that are newer to coaching, when we look at shifts in emphasis in our care, right? Bringing in active self-management for chronic symptoms or chronic findings, that means that purpose-driven process is the vision for care that Sara was referring to. So that's the coaching process, but how are clinicians also reinforcing that language, reinforcing that lens. And the coach is really providing this deeper bench for us to lean into self-agency. That's really important for medically complex patients. And so coaches have this a recipe, which is the coaching process. And it's this tried and true, evidence-informed, what are the mechanisms that support, what are the mechanisms in a coaching interaction that supports sustainable health behavior changes. When the coaching process really is that mechanism, it is the way, and it's tried and true with lots of outcomes that show that longitudinal behavior change that impacts challenges to health in a very positive way. The coaching process works so beautifully. And then for clinicians, we also have to think about a recipe. And when we think about the word recipe, about a goal or a product-driven process like like cooking, for example. So when we think about what we're going to cook, it's because we want to make something to eat, right? That's going to sustain us and nourish us. And so when we think about that, we have to think about, well, what do we want, right? What tools do we have at our disposal? What ingredients do we need? How do we incorporate the different skills that are needed throughout the process of making something, right? So if the coach's recipe is the coaching process, um, the recipe for veterans is actually an act of discovery. Like, what is the recipe for me? If I've had chronic back pain or I have a headache or challenges with my mood, for example, what is the magic combination of things, which may include things like medications, of course, or interventions like physical therapy, but also can and almost nearly must include self-management. What are the things that support for my life, my challenges, my medical challenges as a veteran, right? What's my recipe for healing and recovery? And for anybody with chronic medical challenges, again, that recipe is unique. And so the coach uses the recipe of the coaching process, which is known. The veteran, along with their coach and clinical care team, is really discovering what their own recipe is for their own unique healing journey.
So many great metaphors there, and I'll try to reflect a few things back. First of all, Sarah, I love the word capacity there instead of strength, right? Because capacity is a combination of just your strength, but internal, external resources as well, and your motivation to use those strengths, right? So I think capacity. Thank you for that kind of, I think, more accurate and holistic word there. Also loved MAP, mission, aspiration, purpose. Acronyms are fantastic, and you've alluded to that. Going off of this recipe analogy, what really struck me there is a few things that recipes are reproducible and leave room for individualization.
Yeah,
Right? If you look at any of those kind of cooking programs, everyone has the same ingredients. They all make good dishes, but they're slightly different, and they all work. Right? They have the same amount of protein in there, same amount of carbohydrates in there, but the flavor might be different, how it shows up. And so I think it's a beautiful. I think we're coaching. Anything has an art to the science of it, right? The science is
Mhm.
based off of, and the art is how you apply it with a scientific lens, right? Our own unique perspective, and just like cooking, it's really like you mentioned, Dr. Clark, that the whole is more than some of the parts, right? That it's not just the whole person, that synergistic effect when it all comes together. You're not just a headache or a A1C or a feeling that you have. It's one system. It's one plate that's coming together, right? And I'll maybe add a little one more thing here. Oh, I don't know how heart came up. I'll add one more thing here too to that metaphor that came to mind. Maybe I love eating a lot, and when someone cooks for me, I really appreciate it. I'm not a very good cook myself, so when someone does it for me, I'm like, wow. And I always think, other animals will resource share, right? Lions catch something, they share with their tribe. But we, because we're humans, we have these thumbs and this frontal cortex and this love in our heart. We go through the process of not only resource sharing, but putting love into that recipe and making that your experience of those calories is more enjoyable.
Mm.
Right. And so I think it's kind of lines up nice with coaching, that we're not just giving people solutions to do it, but also the process. It's process focused, and hopefully the learning in that process, because we're both putting love into that equation. Right. The rest of these we are doing as providers, the love for themselves that our clients are showing, to be brave enough to try and really take that ownership. And I think
Mm.
coaching is finally doing what Dr. Clark, you kind of alluded to, that was missing, I think, in medicine, is putting the client or the patient back into the equation. It's not just lab results we're working
Mhm.
with. It's not a chart biopsy we're doing. It's how you're feeling is the most important part. No lab tells me how you're doing. No image tells me your
Yeah.
motivation. This is a self-reported thing. And it really puts that individual approach into a scientific lens to reproduce.
Yeah.
Um, so speaking of, before I go too
Absolutely.
offside there, or anything else you want to say, that, sorry, I didn't mean to cut you off, Jan. There's a little bit lag there. Did I cut you
Oh
guys
no,
off?
I was just agreeing with you. I just said absolutely. And as you're talking, I was just thinking about, I worked in VA for most of my career, and as you're talking, I was just thinking about, this is that approach. Uh, is really something that the VA has done so intentionally. And as VA has identified the whole health approach as the VA's approach to care, this is really part of the reason. We're talking about softer things. I love like, bringing the word love in here. That's really key, because to hold space for somebody in that journey is a really loving process. So those sound like soft skills to some, right? But I truly believe that that the same reasons that the VA would approach the whole health approach to care, that the VA would support health and wellness coaching in the way that they have. This is also one of the reasons that when you shift to thinking about softer skills, to looking at things like quality outcomes, this approach is part of the reason that the VA is consistently ranks so highly. And I don't know if everybody's aware of that. The VA ranks so highly when we look at quality measures. And these may be things like post-operative infections, but also broader categories of mortality, safety of care, the number of readmission data, the patient experience, and patients feeling like veterans feeling like their care is centered around them, and also timely and effective care. These are quality measures for which VA consistently outperforms many other aspects of health systems in our country. And those skills that we're talking about are part of the reason that those things happen.
Yeah. And, we're talking about what you guys have created, but let's be real. Systemic change is very hard, takes a lot of effort. Change is hard for everyone. For one person, as we know as coaches, right? But for a system, it's multiply that times many. So it is no small feat to get to where we are today. But if you can give us a little bit of history, how did it get to there? How did you start integrating health and wellness coaches? Because for those who don't know, like, we could thank you guys for all the research that one day went to the board. So how did you guys approach when ground one? What is a coach 20 years ago, or how long ago? How was that beginning part of the journey that led us to the change we see now?
Well, a lot of the coach integration really aligns with the VA's approach to whole person care and the whole health approach. So the coaches really have this capacity to help veterans navigate complex conditions by empowering them to take an active role in their health journey. And it creates a lot of connection points in between what look like little islands of care between a time that a veteran may see their primary care physician, or see their cardiologist, or go to physical therapy. Um, when a veteran is also engaged in health and wellness coaching, that is a longitudinal process that's parallel to all of those points in time that look like separate events, but the coaching process really creates that as a seamless journey. Um, and Sarah, I don't know if you want to think more about that in terms of how coaches are interacting with care teams, or.
Oh, yeah, absolutely. So it did take quite a bit of a long journey to get to where we are right now. And currently, right now, in terms of the current landscape, we have coaches that are working alongside primary care teams. They're embedded in pain management teams. They're embedded in women's care clinics. They're also operating outside of specialty care, primary care, mental health, within the community. And the goal here is really to support that continuity and coordination of care, and also to support the clinical care teams that they're embedded with. Our health and wellness coaches are leading individual, also group coaching sessions. We've leaned into the group coaching sessions over the last year or so, just to support increased access to coaching. And they also can deliver these in person and virtually. I think in terms of the conversation around support for chronic disease management and pain management, Dr. Clark, you're welcome to take the lead on that conversation. But the coaches are truly throughout the healthcare system, embedded in many different areas. And we're also taking a look at the outcomes associated with that work too, like we mentioned, Dr. Salinas.
Yeah, we really have to think about, so from having the coach walking that parallel journey with us, um, when we're leaning into supporting, if you're a coach, a client, but if a clinician seeing a patient, in our case, of course, veterans, if you have an overwhelming challenge like a significant chronic pain issue, one of the that's really over time has only taken away, right? It's taken away your capacity to work in your vegetable garden, to ride your motorcycle, to
Mm.
go fishing, to go to your granddaughter's soccer game, right? And so one of the first things that we have to think about doing from a chronic disease management standpoint, and this is where coaches have so much to teach us as clinicians, is first we have to look at connecting back to life. And even before a symptom has been shifted by the treatment recipe that we're talking about, how do we work to make life bigger around the symptom? Even if your pain doesn't change, how do we make life bigger around that pain, right? And so there's so much of this really involves a language shift. And I'll just give the
Mm.
example of um, talking about symptoms versus talking about what how the MRI report reveals. And I'll just identify that there's never been a time in my career when somebody's had, for example, and I'll just use the example of a pain challenge. If that pain is really impacting their life and they have an imaging, say an X-ray or an MRI that has some abnormal findings, that person experiencing that challenge will have that MRI report memorized. Why? Because it explains, right? It gives them explains and roots the nature of their challenge in something that makes sense, like it's part of their story. However, we have to retool our language as clinicians because what we know is, and I'll just use the example of an MRI, if you line up 10 patient stories with varying severity of a pain condition, and then in another column have 10 and have them be in, all mixed up, no findings on an MRI to really a significant amount of abnormal findings on an MRI. You would think you'd be able to match the most severe symptoms with the MRI that has the most significant amount of abnormal findings. That's simply not the case. And so when we as a healthcare system put too much emphasis into those things, we create a problem with our language, right? So when we're talking about somebody having a herniated disc and neuroforaminal narrowing at L4, L5, that's something in a picture that looks completely immutable, right? It's simply a fact, right? But we know that that actually has very little to do with defining pain and the experience of pain. So it serves us as clinicians to lean into some of that process work that coaches teach us and to talk more about symptoms and findings, for example. So rather than saying, degenerative disc disease, which is a label that we sort of stick to your forehead, right? When you talk about a symptom like low back pain that's worse with activity, or knee pain that's worse with deep flexion, right? Then you're describing something that is part of a process, right? It sits somewhere on the spectrum, that it comes from something, it leads to something, and we can look at the trajectory of a symptom. It's got a past, a present, it has a future. And when we can see it on the spectrum and it's something that's described, we can actually shift it in a very system-driven way. So we might not say the word diabetes as clinicians. We might choose sometimes to instead talk about an elevated blood sugar or to talk about insulin resistance, because this is rooting the person we're caring for into a process, into their looking at their system, looking at how is this system designed to get the results it's getting? How can I better design this system so that the outcome is better? And so this is really rooting a discussion about a medical challenge more in possibility. Um, And at this point of possibility, right, that's where the coach comes in. So we really have all of this opportunity in this process of care um, to use our own language as clinicians to support the coaching process. And then the coach process, of course, in turn is going to support optimal clinical outcomes.
I'm loving this theme of like really this systems approach. As one gets better, the other gets better. Let me try to digest some of what you both just said. So one thing, actually, I'll start kind of backwards. You mentioned Dr. Clark. I saw this too. I remember when I was in residency. You might have, let's say, a day at a certain clinic where everyone has a very similar diagnosis, right? So maybe you're an endocrinology clinic, everyone has type 1 diabetes for kids, or you're a nephrology clinic, everyone has some sort of renal failure, or you're on a certain floor with very similar diagnosis room to room. And what stood out to me early on was, on paper, on the chart biopsy, it all can seem so similar. But when you walk into the room, what a
Mm.
different experience of life, right? Sometimes some people get a new diagnosis. It is catastrophic. It's all I see the world through. Other room has the same diagnosis. They're laughing with you, joking. They're still doing their living activities, right? And so really connecting back to life, that you are not just, your experience of life is everything. What's on your chart, what's not on your chart, right? And helping people connect to what gives them their life force. And
Mm.
I think in medicine, we try to have a diagnosis so we can now know what to treat. If we know the diagnosis, we know a treatment plan. But the double-edged sword is really that it can actually narrow down treatment plans and label people. And I've seen many people, whether that's physical health or mental health, oh, it's my insert blank here, my ADHD, my depression, my this, my that. And instead of being helpful, can just limit it and become a thing to hold you back, versus how do I work with those things that sometimes are challenge for me and bring strengths to there. And you said that kind of coaching, I think it's long Sarah too, that coaching kind of cytoplasm holds it all together, because as someone with medical complexity, you might have a lot of providers, and medicine has become so segmented. One benefit is that people know a lot about a certain category, but the patient knows very little about all those categories and how they come together. And I started going to primary care for that reason. I think coaching, as you said, really holds it together. It's like the cytoplasm, right?
Yeah.
Between the sessions, it's out. It's explaining what was diagnosed and how it might play into you. How's that playing with what your rheumatologist told you and what your GP told you, and
Mhm.
you and your grandkids and that plan to go fishing is come up with? How do these
Mm.
all really come together? And I love. A last thing I'll say here is that the coaching is starting to change the clinical language, right? That this is we're all learning from each other. And one thing I loved in complex healthcare systems is that interdisciplinary work. No one person is the expert on everything, and that curbside consult, right? That coaches do bring a completely different skill set than clinically trained providers, and we need more of that learning to clinical providers so they can start getting back to what I think we all started, that journey with, to look at a whole person. But sometimes we got lost on the way, focusing so much on the trees, we lose sight of the forest. Let me pause. There's a lot of reflections at one time, but that's kind of all the things
Wow.
running through my mind.
Um, those are so
It makes me think
powerful.
about it makes you think about how it's such a non-zero sum game too. Because if we use like that example that we were talking about earlier of somebody having a mental health challenge, but a metabolic challenge like diabetes, and then a pain challenge, for example. So if a coach has a mechanism to take somebody who's been very sedentary, who gets pain if they're very active, and they say, okay, walking for 10 minutes is really challenging for you. Let's not do that. But can you walk for 3 minutes, 3 times a day, right? If we think about that as a dose, right? Because we're really inspired as clinicians to always see things as a dose and to think about where it's directed. Um, like we don't have to say, oh, this time I'm walking, this is going to benefit my diabetes, but this next dose is for my pain, and this next dose is for my metabolic challenge, right? That the coach's work impacts the foundation of the system problem in such a way that it's really more about compound interest rather than a linear process, or maintaining a trajectory of not getting worse. So that's what I was thinking about when you were just talking, Dr. Salinas. Like it has this capacity to to create exponential growth in places that we often think of trying to maintain if we're lucky.
Mm-hmm.
Compound wellness. Yeah. And Sarah, I think you had something to say. I didn't mean to cut you off too as well. Do you have anything to add to that, Sarah?
I loved your reflection around the coach's role in between clinical visits, and one of the things we're also working on is the coach's role before the annual primary care visit, and how can the coach set up the veteran for a visit that's reflecting their mission, aspiration, and purpose, and also set up the clinical team to receive that information. So there's just so many ways to integrate the coach, not only between visits, but before that annual visit, kind of summarizing where they're at, where they want to go, what's important to them now, and having the veteran empowered to have that conversation as well.
Yeah, it's a great call out, Sarah, that like really there's in between, again, holding all together. They can talk to the clinical teams, understand what's the clinically relevant or important outcomes, right? But more importantly, what is Bob's outcome? And some people do have it is scary. My dad was a surgeon. He said, listen, it might be
Mm-hmm.
your 30th person you see that day, but they've been waiting for a month or two to see you. This is a big deal,
Mm-hmm.
right? And here's a reality in healthcare. I think there's a study been reproduced a few times, is how long a patient talks before a doctor interrupts them. I think it used to be 19 seconds, then it became 12, now it's 9. It keeps on getting shorter and shorter.
Mm-hmm.
And we have this list of 35 questions and review of systems, and then we go, hey, by the way, any questions you have for us? Like, what are the odds that your frontal cortex can hold on to that after just being bombarded with all these questions? And plus you're scared or you're nervous, or like something my dad always said too. He goes, listen, people come in the back of their minds, let them know if it's not a life or death thing. They don't know that, they also have the horror story. My one friend went to the doctor and all of a sudden insert bad news here. Right. So I think even looking how coaches can even help people prepare for situations, organize a medical chart, write the questions down. I had many of my clients prep for the session or prep for surgery and post-op care, right? We know if you're better prepared physically, you're going to do better. Why not prepare mentally? So now you understand how you're going to go for that day of surgery and who your team is supports you afterwards at home or in the hospital. There's so many ways that this one extra profession really again can tie this otherwise disjointed system together, right? And make the most of it. I know the story, but I'm wondering for maybe share with our audience. You've shared different videos before in the past, and I think there's a few veterans of like really amazing transport stories. And Dr. Clark, we mentioned how different it was from a clinician point of view, seeing patients explain that story. I don't know if I said person's name or what pseudonym you want to give them, but could you share it's Jim, the story you've shared with me in the past and his story, so people see
Yeah.
who aren't coaches what it might be like, what the actual implication of this kind of theoretical framework can do.
Yeah. Yeah, thank you for this prompt. Sarah and I have talked about the story of Jim, which is not really this veteran's name, but because I can't think. I've seen some amazing stories associated with coaching. I mean, too numerous to list. But this one always stuck out in my mind because it was one of my first experiences as a clinician with the power of coaching. And this came at a time that I was really trying to retool my practice to be deeply whole health embedded, right? Asking all those questions about what matters most to you, what you want your health for. And this was in a pain clinic, and I was seeing a gentleman and he was in his mid-50s, and he was really struggling with that intersectionality of medical challenges that I was talking about, heart failure, pain in many joints that it was very limiting to his life, and diabetes, had a 30-pound weight gain, which is not optimal for his frame over the last couple of years, multiple medical challenges. And I was using a whole health approach, and I kept thinking that I was failing because I would, pull up the circle of health, and that's something in VA, for example. We look at different areas of self-management and self-care and talk about, where you might want to start that might support your pain. And this particular person had super problematic schedule. He was getting no sleep. He'd stay up till 3 in the morning, and then he'd sleep till 1 in the afternoon. And then his nutrition, like his food plan, was essentially to drive to a nearby gas station, pick up a 2-liter bottle of Mountain Dew and a pizza, And but he like ate the rest of the day while he was in his recliner watching TV or playing video games. And so, but he had this service dog that he loved beyond reason, and he felt like the dog wasn't getting the kind of life he needed. So in that context, I'm talking to him about how challenging his schedule might be, this lack of sleep, and his food choices might be, and I knew, and making fun of myself, like in all my humility, right, that I was so sure it was really important for him to make a shift there. And he didn't really want to talk about self-care, self-management. And then really roughly like 3 or 4 visits in, he pointed to the circle and he said, I need to clean my kitchen. Where is that? Where's that on your circle? I was like, well, I guess I can clean the surroundings. And I, asked him, tell me a little bit more about that. And his dog's favorite spot was in a sunny corner in the kitchen. And I was like, okay. And that I was like, oh, I failed. Like, is that something that's he's still gonna stay up till 4 in the morning. He's still gonna sleep till 1 in the afternoon. He's still gonna get that pizza and 2-liter bottle of Mountain Dew, right? So I talked with him about it a little bit, tried to engage on it. But then I did ask him if he wanted to work with a coach on this because it was going to be very challenging for him because he could not be active for any length of time. He had actually timed it 8 minutes. I can't do anything for longer than 8 minutes, and then I guess. So we started working with a coach. He missed his next appointment. We had we live in Iowa, so there's always some fabulous weather issue that keeps people from care. And so he missed his next appointment. And then I didn't see him for a while. He came in 3 or 4 months later, and I recognized the dog in the hallway before I recognized him. Because he had a massive physical transformation. Just for the sake of time, I won't necessarily talk about it, but it was unrecognizable. Just had markers that may have identified life isn't going well. I might not be particularly functional in many areas. All of those things resolved. Had a significant shift in, the amount of weight he was carrying, for example. Well and neatly groomed and walking down the hall with a spring in his step. And he came in and I said, I think you have a story to tell me. He said, yeah, I clean my kitchen. And so this is just a moment of humility for me as a clinician because he cleaned a corner in the kitchen so that he could put the dog's bed in the sunny spot that the dog loved. It was his favorite spot. But then the dog wanted him to be in the kitchen with him, so he cleaned off his kitchen table. And then he cleaned off the counter that was next to that so he could put his coffee cup down, which led him to cleaning off his counter. And then he actually got cleaned for so long that he went to bed early. And then the next morning he woke up at 8 o'clock, which is the first time that had happened. And he thought about 15 years. And his kitchen was clean, so he made a pot of coffee. And he calls it the pot of coffee because that was the moment that that was the day he didn't drive to the gas station for a pizza. And that led to him himself making breakfast in the morning, shifting his schedule, being able to go out into the yard with his dog, which led to him walking around the block with his dog. Everything turned on him cleaning his kitchen. And as a clinician, how do we see the gold in that when somebody does that? What that meant for him was that I don't know how many months later he had lost 82 pounds. He was off his diabetes medication. He was off his insulin. He was walking 2 miles a day. He was eating 3 meals a day. His schedule challenges had resolved. It deeply impacted his mood in a very positive way. And so I don't mean to make this too long a story, but when I look back in the notes, as a clinician, I don't know if I could have predicted the difference that would have made. But when I look back at the coach's notes, the coach saw all the possibilities. And so when I think of that story, I think of the gift of coaches. And for all you coaches out here listening to this story, I know you're nodding because you've seen this person. You've been engaged with this person and you've seen this story. There's your work as a coach, if you're listening to me, it cannot be overstated. Like this, it saves lives. and it saved Jim's life.
Mhm.
So that's one story that Sarah and I like to refer to sometimes. We call it the kitchen story.
Yeah.
Even though I've heard it before, I still get a little emotional. Like I want to go hug my dog now and take him on a walk right now. I've been neglecting. I'm like, gotta compose up here too. But I think it's a beautiful example. And I know Dr. Clark and I talked about, we learned in medical school this one approach, and we get so focused in on something. There's no part in the chart that they clean their kitchen, right? Or what's important to them. It's not a lab we do, and it reminds me very different story. But early on when I was doing my coach training, a asked my friends, hey, anyone who wants some free coaching? I'm trying to sit for the board exam. I'm trying to, get my sessions. And so someone said, oh, I know someone who, they're a nice guy. He's open, do you a favor. So he let me give him a micro session. We did like an hour and a half long session. And I went to his house to do this. So it was a friend of a friend. So I was all right, feel safe enough. Nice guy. He worked in like property management, but his house had a bedroom and two other rooms. The two rooms were meant for music. One was a recording studio, one was a jam room. He loved making music in his spare time. It wasn't his profession, but his kind of passion. And so I'm like, hey, what do you want to work on today? And I had a wheel of health, something similar to that, right? And by the way, to all your coaches listening, I always say this is an example of looking at your health holistically. My wheel of health, I add creativity for mine. That's important for me. One of my clients made a pyramid of health. Someone I know as a coach had a client as an artist, did like a color wheel. The whole point is there's just a way to look at yourself holistically. We're one big system, not our work and home life, same cells. So of course they affect each other, right? And so I gave him this wheel of health, and so he goes, I'm like, what do I explore today for your health and well-being? And he said, well, you're a health coach, so I guess I got to work on stopping vaping. And Janet, maybe because I had a little more coaching training at that point, I kind of went on a hunch. And I was like, I said, what do you actually want to work on? He goes, what do you mean? I'm like, you didn't sound super convinced when you said I got to work on this. And I'm like, and I explained that we can work on anything you want. We can try to make anything a process model, et cetera, et cetera. Long story long, he decided, hey man, I'm working on a CD for my sister for her birthday. It's already way overdue. Her birthday passed like a few months ago. I'm still working on a CD. Can we work on me finishing this project? And I was like, we can, in theory, work on anything to make it a process model. So, and I know I play guitar and a little bit of music recording stuff. So we went on the rabbit hole in terms of resources and what to record with and blah, 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 and mic placement. End of the day, very similar to the kitchen, Janet, his goal was, you know what? I'm going to write the songs in my kitchen, the only room in his house not dedicated to music, because there's a little bit of sunlight in there. All right. And so that was the end of our session, and, wished him well. I saw him at a gathering like months later. I don't know if exact timeline. I was 4 to 6 months later, something like that. And I always tell my clients, if I see you in public, it's up to you to acknowledge me, not the way around. It's your privacy, right? I pretend I don't know you. But he pulled me aside. He goes, hey man, by the way, I finished this recording and I stopped vaping. Right? I didn't tell him to stop vaping, right? But that snowball effect, right? That confidence, success remembered. And that, I think one thing as I've learned from coaching, it's a little neuroscience in here too. Every brain is different mathematically, right? 100 billion neurons, 10 trillion synapses. But what is similar is like the recipe. There's something that drives us. Now, what that is, for some people, it's competition. Some people, it's collaboration. I have a story about that too as well, right? We all have byproducts of exhaust that aren't good for our system we have to deal with. But what those things are so unique to each person. I think coaching doesn't, for those who aren't coaches is not about giving motivational speeches or throwing out taglines or saying what worked for me. It is cultivating what's already in there, that natural motivator that we all have, even though it might be buried under shame, guilt, layers, obligation, lack of efficacy, but there is something there. And it's getting rid of that and just cultivating what's already naturally there and letting it shine through. So like your client Jim, or that one, let's call mine Steve, right? And I think maybe the last thing I'll say here, the last thing is that these stories remind us that change can feel so overwhelming. But just like Jim did it little by little, right? Clearing the table, doing thing, and one day that coffee pot is that how do you eat elephant? One bite at a time. And life
Mm.
really can change in a day. We see it often in trauma responses, right? Someone has a
Yeah.
traumatic experience, life changes. But life can also change positively a day. It's a trajectory of life that changes. And it might seem small to make a pot of coffee, but looking at Jim, 80-something-pound loss, off medication, walking around, that 3-degree difference a year later is a massive compound well-being difference. So, yeah, wow. Thank you for sharing Jim's story and reminding me of Steve at the time being. Yeah.
Yeah, that's a great story. It's so yeah. That's a perfect story to outline that. And I love that you brought in the word shame
Mm.
because when we look at, I'm trying to think who said this. Sara will know because she has this amazing brain. But in our coach education, we talk about the fact when you're having a challenge with a health behavior, that there's always a corresponding unmet emotional need, right? And so he pulled out this random thing of cleaning the kitchen, and all I could see was the random nature of it, right? Because I didn't know him, I didn't have his lived experience. I later found out that the last time he had recently lost his mother, the last time his mother was at his house, um, he was trying to get her to come through the front door because the kitchen was so bad. Like he said, it looked like like kind of like a hoarding situation. It was really intense. And so he didn't want her to see the kitchen. He didn't catch her. She came into the back door. She came to the kitchen. He said, I'll never forget the look on her face because it was just like worry and fear and overwhelm. And he said, I lost my mom shortly after that. And he said, I didn't realize. I knew it was painful because I didn't realize how painful and overwhelming that message was to me. And he said, I know she can see me and she can see me in the morning sitting with my dog having coffee and making scrambled eggs
Mm.
so when you bring the word shame in, I think that's so incredibly powerful, and how we don't know, and Sara and I have talked about this before, we don't know those things that people are carrying, that they might never talk to you about it, but that's how they're connecting the dots. And so we have to trust them, right? We have to trust them to know what they need.
Yeah, I think that's such an important part of coaching. And what's striking in both of those stories is really the coach's role in meeting the client where they are, meeting them right in that moment where they are, where they're ready to get started, and then supporting success in action step and planning so that they can elevate their belief in themselves to do the next thing. So elevating the self-efficacy beliefs, so powerful.
To me, I'll say before I go to the next question I have for you guys is that when I found coaching, which was completely by accident, and I've said so a few times before, so for time today, I won't get into it now. But I was like, oh, this is the first time I'm actually seeing individualized medicine,
Uh,
right?
yeah.
Like in pediatrics, well, in peds we do dose by weight at least, mgs per kg, so it's a little individual per person. But the first time I'm seeing unique dosages, unique prescriptions for each person. This is the thing we talk about in the future of medicine, right? We'll have genomic
Mhm.
studies and give Sara a little different than Dr. Clark and me, but coaching is already individualized medicine or preventative or positive doses, whatever you want
Mhm.
to label it, because we're not diagnosing as coaches or
Mhm.
treating, but I think that maybe individualized well-being, right? It really is this thing that we think will be in
Okay.
the future one day through some cool pill or lab, but I think this is the first example of it. And since we'll talk about examples, these are wonderful stories. We mentioned recipes are reproducible, right? And science is not based on anecdotal evidence, but on anecdotal evidence being like, there's something here. Let's do some research on this to see if this actually is a correlation or our minds are just playing fun tricks and making associations when there are none, right? And again, I'll be honest, you preface this question. When I took my coaching program, they did a demo and I was like, this is amazing. And they go, oh, there's also boards now. It's a subset of MBME. I'm like,
Mhm.
oh, the boards? I was like, and I know how hard systemic change is for that level. So, and the VA really is one of the leaders in those fields. So for also our scientifically minded people here too, if you can maybe give us some, give some anecdotal evidence of people's stories, but what are the big population differences you're seeing as you apply this thing nationally? If you can give us some of the many awesome things you guys have looked into.
That's such an important question. Because one of the things we hear a lot is, does coaching really make a measurable difference? And the answer, based on growing evidence, inside the VA and outside the VA, is yes, absolutely. One of the strongest examples we're seeing is really in the area of chronic disease management. And Dr. Clark alluded to that earlier today. But so conditions that are like hypertension, diabetes, where we have a need for regular preventative screenings. These are really the long-term health issues where day-to-day habits are really mattering, and where small and consistent changes like Jim and Steve can really make a huge difference over time. So in an ongoing study in the VA, veterans who engaged in the coaching process, we're talking about true engagement, usually 8 or more sessions. A standard partnership in the VA, we're looking at 8 to 12 sessions. But 8 or more sessions really showed meaningful improvement over the following year in these chronic disease management markers. So we were able to see higher rates of colorectal screening, colorectal cancer screening. So more veterans that reached controlled blood pressure, and more veterans that were managing their diabetes in that study. And I think what is so important here is that these changes didn't come instead of clinical care. They came alongside of it. So coaching really seems to help veterans follow through on those everyday behaviors, the ones that make a difference, the ones that they're doing every day in their life, bringing awareness to behaviors that may be aligned with their values or maybe aren't aligned with their values. So elevating some awareness there, taking medications consistently, and sleeping and eating in ways that are supportive. Staying physically active, checking blood pressure at home, all of those small but really critical steps we know that add up over time. We're also seeing coaching making a difference in areas where lifestyle change is incredibly challenging. So things like tobacco use. So recent evaluation, veterans who worked with a health and wellness coach were significantly more likely to quit smoking and sustain that change over time compared to those receiving the standard tobacco cessation support alone. So really coaches helping to kind of identify the motivation and the pathways to have sustained change. And then another really powerful pattern, this is one that really excites me along the way, is we're seeing increased engagement in health services. So veterans who stay with coaching, that standard coaching partnership for multiple sessions, they're more likely to actually follow up with things like physical therapy, evidence-based psychotherapy. So this is telling us that the coach is supporting momentum, kind of helping veterans feel ready and confident to take those next steps in their care. Dr. Clark, I'm not sure if you wanted to share more about mental health and stress or anything in addition to chronic disease management, but so many different evaluations taking place in the VA.
Yeah, I think there's the example that when we look at some different sites over a period of months, that their veterans really report improvements in their mental well-being, greater confidence in managing their health, and lower stress. And then also, and this is particularly important to us right now because this is always important in VA, in a small pilot where veterans were experiencing identifying suicidal ideation, the coaching model was not only really well received by those veterans, it was associated with a reduction in anxiety, depression, and perceived stress. And that was a pilot. So this is very early on. And so the question that we're going to be continuing to want to answer is to pursue, more evidence about how meaningful a non-clinician, right, or not a conventional clinician, right? Coaches aren't conventional clinicians, but they do a lot of work that's pursuant to clinical care and to treatment plans. And
Mm-hmm.
so it really points to how meaningful a non-clinical, a non-conventional clinical, and a strengths-based partnership um, can be, especially when veterans do have that opportunity to experience the full coaching process and 8 or more visits. And what Sara commented on about an increased likelihood to be involved with an evidence-based psychotherapy. And so these are evidence-based therapies for mental health challenges. These are the things that have been shown to be proven to be very efficacious and supportive for veterans that are experiencing mental health challenges. But it's also really hard when you're experiencing a mental health challenge to have the functional capacity to get to appointments and to participate
Right.
in those things. And so the fact that we saw coaching associated at least with the capacity to participate fully in an evidence-based psychotherapy and to be shown to be participating in that over a longer period of time is something, that's initial data that we're very interested in continuing to follow up on and deeply explore. But we do see a consistent pattern, and that coaching really, helps the veteran to build, confidence and their motivation and clarity about not just what they want to work on, but why, and to pull their own strengths and motivations out with the support of the coach. And that's real transformation, not just for the individual, but also for our healthcare system.
Mm.
Yeah. As you both sharing a story, and like Sarah, you mentioned people utilizing one of these resources that came back to work capacity earlier, right? So not only their inner strength, but engaging with the tools that are available to them. And for all you coaches out there, coaching and therapy are not competing. They're different things that we're doing. And I've referred my clients when they had a traumatic event during our work to see a
Oh yeah.
therapist. I've referred me to do behavior change. Like, right, they're different professions, and there's room for all of us. And I work in mental health coaching myself, and so your pilot study that still needs to be published, but it really does fall in line with what we see in conventional studies, that talking about suicidal ideation doesn't create more of it. On the contrary, it actually helps those symptoms. So it really does seem aligned with kind of what we know already, that you create a space for someone to feel safe exploring that versus letting that fester and
Mm.
kind of raw or grow on the inside. So I'm really curious to hear where it comes out, but I wouldn't be surprised if it is aligned with what we already know in general mental health, and that coaches both give people strengths and give them the capacity to utilize those other external resources to continue building more strength, right? This is a kind of positive feedback loop. And we're so used to feeling when our life is falling apart, right? But that means it's all connected. So if it all falls apart together, it could also all raise up together. It's all correlated,
Mm.
right? So if we've all seen that one where it all feels like going bad, that same can go on the upwards trend too. And I'll say too, I'm really curious to think all the amazing research done already, but I think there's so much more, even qualitative data on the table, right? Because we do the PHQ, the GAD-9s, we want to make all these things into numbers. But anyone who's a coach, when you see someone go, "Wow, this today was incredible," like we see that change. Maybe it's lost in the ether because no one had him rated on a 1 to 5 scale. But I think I'm wondering, with AI and transcriptions, we can maybe gather more of that qualitative change that we see people say. And my hypothesis is when that qualitative change happens, you're going to see the numbers fall behind, right? When Jim feels a little better with a cup of coffee, his weight will go down, right? So I think it's exciting to see, to explore more what we already know. So I guess intuitively 1 to 1, and show more efficacy in more ways that this can show up. But speaking of showing up, right? Like we kind of discussed a little earlier, how you guys got started, but it is hard to make these recipe that works in all the VA everywhere and has that modularity, right? Approach. So how do you guys create frameworks around how coaches are going to successfully implement this in the VA, right? So what is like the how do you guys, I don't want to say standardize, but yeah, give the recipe book for all the VAs in different areas to be able to get the benefit from what we know works?
Yeah. I can take this one, but definitely love to have Dr. Clark chime in. When we kind of think about the many professional roles that kind of make up the healthcare team, most people are picturing, the physician, the nurse, the licensed clinical social worker, registered dietitian, maybe a physical therapist, those conventional positions that we're really all familiar with. But one of the remarkable things we've been able to accomplish in the VA is the addition of the health and wellness coach as a recognized occupation, profession.
Mm.
And I wanted to bring that forward because that really set the framework for which we can support integration. We did this through what we call a formal qualification standard in the VA, and it came about reflecting the growing understanding that chronic conditions require not only clinical care but also that sustainable behavior change part. Really, the behavior change that aligns with a person's values and sense of purpose. So it's really not often that an entirely new role is added to the healthcare landscape, right? I know that this is sort of a novel kind of situation in the VA with certainty, but likely in other systems that are working on this. And we've had the privilege of doing this at a moment where self-management and whole person care are really more important than ever. And then also having that whole health system model to support the integration of health and wellness coaching. So across the agency right now, we have approximately over 350 full-time health and wellness coaches. We also have coach supervisors and experienced coach mentors that are embedded throughout the system. And they are there to support the growth of this emerging profession. And more recently, our efforts have been focused on integration, helping the rest of the healthcare team understand the value the coach brings, and then building an informed culture that supports this new member of the team. And Dr. Clark speaks so beautifully to clinical care integration, so I'll turn things over to her, and I'm happy to share a little bit more about our framework as well.
Yeah, and the framework I think is exciting to talk about because it really is quite it's quite an exercise, an intellectual exercise, but it's also an exercise in collaboration. And really creating, I think about the analogy of a garden, and you have to create fertile ground for a new profession to grow in. And when we think about the coach's connection to clinical teams, right, the coach role to come in to support the patient, the veteran, to support clinical teams, it takes a lot of clarification. I think about something as simple like who's going to supervise a coach? If a coach if it's a new role, we have this kind of blessing that when you say the word coach, people have an inherent understanding of that. When you think about bringing a coach into healthcare, everybody struggles with their health behaviors, right? That word makes sense. On some level, it's very intuitive. So that's a blessing. The double edge to that is that everybody has a different vision of what that looks like. So how do we create that shared vision, right? And the example of bringing in supervision and how do you supervise coaches, it's been an incredible amount of work for our team, for Sara, and for extended folks in our office, but also in the fields to work to create an optimal capacity for coaches simply to be supervised. But thinking, and this is where some of my work comes in, is partnering with other roles. And so everybody in healthcare, uses some coaching, right? Or some aspects, or at least aspires to be supportive in that way. And to believe in the person in front of you and to support their capacity for change, right? Coaches are trained in the art of that, right? We would probably all, aspire to be able to do that. So how do we intersect then with nurses, with dietitians, or physical therapists? Because these roles, as this new coach role is coming in, it's very important that they understand that the coach is not making nutrition plans, right? which would impact and overlap the work of the RD, but the coach would be there to support it, right? They
Right.
aren't prescribing exercise. They're not talking about ketogenic diets, right? They're not talking about how to train for a 2K, right? Or making any recommendations of any kind, right? And so helping all of our many clinical stakeholders understand the coach role and see how that role, touches on theirs and how it connects to their work. That's been a decades long conversation, really.
Mm.
And so that's been a big part of our work as we've brought the coach profession on board and created a mechanism to hire somebody. Like in VA, you come in, you are hired as a coach. You're not necessarily coming in as another kind of clinical person and doing coaching, even though all clinicians have the capacity to use coaching skills. But if we're bringing this new role in, we have to make sure all the stakeholders are really comfortable with that and understand those intersection points. And so um, that's really been a lot of our work as well. I don't know, Sarah, did I miss anything?
That was wonderful. Just a couple of things I'll add in terms of framework. We've developed what we're referring to now as like standardized tools that are supporting the workforce, the health and wellness coaching workforce. So that's really helpful because we're creating some consistency, some quality, some efficiency across the system with these tools. So these are things like the health and wellness coaching note template. We've made iterations of improvement to this template. It supports documentation of encounters, really follows the process nicely, and promotes efficiency across the system. We also elicit lots of feedback. So like I said, lots of changes to that note template over time. We also use similar assessment tools in the VA. We all use a personal health inventory as health and wellness coaches, but also our clinicians are using that tool as well. So it's really nice to kind of be working from the same sort of sheet of music within the system. And that's referred to as a personal health inventory. Can Google it and find it if you're interested in learning more about that tool. We also have toolkits that are supportive of health and wellness coaching in their role, how to develop and grow, how to code and track, how to do all the nuanced, supportive, things that make the job successful, really. And then we also have similar toolkits that are supportive for the supervisors in those roles, because we know that supervising a brand new occupation in a healthcare system is quite daunting at times. And there's a big, heavy lift the supervisor needs to do in terms of supporting that integration piece too. I haven't had a chance to mention the many education training resources that we have available, not only for health and wellness coaches to kind of advance and try on new skills and get some more experience and feedback while they're trying on those skills, but also we have a training program for coach mentors that kind of standardizes the feedback process. And we train clinicians on those coaching skills that Dr. Clark was alluding to. We find it really important that clinicians, they get an opportunity to kind of retrain or train for the first time around coaching skills so that they're getting the similar language and we're having a kind of unified approach to how we're exploring mission, aspiration, and purpose, and how we're setting goals together so that we can support that sustainment across the system. We also, as Dr. Clark alluded to, a lot of work being done to foster that informed culture with teams and leaders and veterans to really understand what health and wellness coaching is and how it complements and supports clinical care. And then I think the last two things I'll just identify in terms of the framework is community. This one's so big and so important. We have what we call communities of practice across the VA. These are really wonderful opportunities for kind of like-minded roles to come together, to share best practices, to get guidance, to request more information, to have direct feedback with each other and with us in the office. And so these robust community of practices take place monthly. Therefore, the health and wellness coaches, they have their own one. Actually, it's occurring right now. We also have a community of practice for our health and wellness coach mentors, where they get a chance to kind of share case studies and bounce ideas off of each other, and get opportunity to kind of develop and train a little bit more as mentors. And then we have a specific community of practice for our supervisors, because like I said, supervising a brand new occupation has its own challenges in and of itself. So providing as much of support and sharing as possible in these communities really are supportive of that first, that integration piece, and then that long-term sustainment, which is our goal. And we talked a little bit of kind of evaluation and research efforts and evidence. So I won't get into that too much, but we always have ongoing efforts that are kind of watching and evaluating health and wellness coaching over time in different settings.
The more you say, I'm like, how'd you guys do all of this? This is so much work, but I guess with a lot of love and patience and collaboration, right? Because I think also the foundation you're laying there, right, defining the scope of practice, right, saying we are hiring people specifically for this role, not that you're this and we're asking you to also figure out how to also coach in the meantime in your off hours or integrate something else. Like, we want someone for a particular skill set, standardizing how we document, how they refer to the providers, a PHI, or the note changing around. And I'm so used to in clinical care, there's so much supervision, a lot of clinical learning or working with people well-being is the art of the science, right? You got to hear other clinicians deliver bad news to figure out how you do or don't do it yourself, right? So I'm so used to shadowing another healthcare worker to learn. And so, in making sure that this new profession has that for everyone's well-being, right? Because we do want to make sure, number one, do no harm, that what we're doing is safe, efficacious. And so that's supervision. So the coaches are doing a safe job. And I'm assuming this is going to really help with what I see a lot is imposterization of coaches, right? Or people feeling imposter syndrome. Well, why me? I'm not a doctor. I'm not a nurse. But to our point, I think we were alluding here, you don't need to be a doctor or nurse to be the world's best coach. And maybe it might be easier to, because you're not unlearning all of this kind of paternalistic kind of diagnostic approach. And so really uplifting them to be their best, and so then they can teach other members of the community. Because Dr. Clark, I remember in medical school, you rotate through one day with personal trainers or physical therapists, one day occupational therapists, kind of get a glimpse of what they're doing. You go to grand rounds and learn from the other specialties. Okay, I may not be a nephrologist, but it's good to know this stuff and how it's not applied. And one thing I've come up with is that medicine is made what to do, but coaching is a how and the why. And I think that's where coaches really translate. Okay, the RD gave you the meal plan and how many grams of sodium you're going to have per day. Okay, the OT told you how much exercise to do, but we are working on the motivation and how you're going to apply that. So plans are about implementing them. Otherwise, just so it's almost the most important part is what rubber meets the road. And I really do think that every physician should learn coaching first. I was like, why was this only a 45-minute lecture during my second year of medical school, which you cannot learn MI versus the PowerPoint, and never experiencing it? And that was, again, only my second out of 7 years of clinical training. Never saw it again until I took coaching. I'm like, this reminds me of one lecture that I thought was interesting during second year. And I guess the last thing I'll try to summarize here is this learning from each other. Again, having these groups that you're having that are both intradisciplinary and interdisciplinary, right? That coaching teaches people how to listen. One of my attendings said, this stethoscope that we carry on our neck all the time as a badge of honor, he goes, this is the most overrated tool in medicine. The biggest function it has is a metaphor. Listen to your patients, right? And community, you said it's practice. Community is medicine, right? That's where all studies show community is where well-being lives, longevity. So community for your patients, for the providers to prevent burnout and caregiver fatigue, right? To learn from each other, those group coaching models you have. So yeah, I'll pause there because a lot of things are reflected at one time. Anything to add to that before I move on?
I love that. And thinking about, clinicians having the capacity to use some of those skills, really that is that language and lens change that we were all kind of talking about earlier. And so that's magic. And then, to your point about coaches maybe not feeling like they should be there because they're not a nurse, a psychologist, a physician, a physical therapist, the reason they're so effective at their work is because they aren't. Right? Think about the magic of, and think about the stress that you experience as a patient when you know you're going to perhaps be hearing recommendations that are going to be challenging for you to achieve, right? Or are attached to biometrics like a change in what your labs are or your blood sugar is higher, that sort of thing. The receipt of those recommendations can be so stressful. And the beauty and the magic of coaching is that it's coming from this person who is never, ever, ever going to tell you what to do. Um, they're talking to you about your capacity and what you want. And how many times in life do we have the luxury of having access to a person who's there sitting in front of you to be only supportive, that has no plans for your time, no plans for what your future should look like. They're here to hear what you think. And I think sometimes when somebody is there in that kind of space, it actually takes a while to get used to having that freedom and that capacity to be with that person who is never has expectations of what you're about to say, who's never going to tell you what to do. And so that's the magic of coaching, is that they aren't coming with all that training. And it's one of the reasons that we value them the most, right? That they are there in this capacity to create a true exploration of the self and purpose and capacity that the capacity that Sara referred to earlier so beautifully, and to uncover strengths, right? People forget sometimes what strength they've had in their life. We talk to veterans, and when we start asking them, they start telling stories, and we can reflect back when they have required so much strength or courage or perseverance, right? The coach is there to bring all that out. What a gift, right?
What a gift. Yeah. And I think it's so powerful because these strengths and reflections to those non-coaches out there, they're not, people think affirmations, I'm going to define it as from a coaching perspective. Affirmations are not just cheerleading and making you can do whatever you want. They're just actually reflecting what actually happened, right? Like, and I did have a client early on who in a few sessions was like, I don't have any strength. And I'm like, didn't you mention you're a veteran who's a single mom and started her own business? Like, neither of those three are easy things to do. And then I'm reflecting that she's like, wait, actually, I do have these X, Y, and Z strengths, right? Just so easy for our brain to forget that, and also forget that we built those strengths. And just so why coaching is so powerful, it's not saying, hey, Sara, no matter what, you can do anything. It's like, Sara, you did X, Y, and Z. This is just factual information. And I think gratitude practices are powerful because they're factual, not made up. I didn't mean I cut you off, Sara, but just want to throw that in there, that it is truly a gift to show people how strong they have been, to inspire them to see how strong they can become.
Yeah, it is. It's such a gift. And I think, applying the coaching process in the VA with veterans is just, it's so wonderful because it's like a gold mine for strengths, right? Like they look at all of the life that they've lived, and in some ways makes that part of our job a little bit easier, just kind of knowing that they've overcome and done so much, and had so much bravery and perseverance alone, just getting them to where they are now. So a lot of work still to be done in the VA, but I do want to just say this was not done alone. This is the work of so many incredible leaders and so many coaches and supervisors and mentors and just so many visionaries in this field as well, and faculty members. So I want to just bring that forward because it's like, how did we do this? We did it the same way we do coaching. We hold this long-term vision aloft, and we tackle it one step at a time. And we're still working at it, but it's exciting to see how far we've come in this amount of time, and I look forward to kind of seeing where we're headed next too.
Yeah, that reminds me of one of my favorite quotes from Newton was we can see so far because we stand on the shoulders of giants, right? And going back to
Mhm.
communities,
Mhm.
this is a big community effort across, and so many
Yeah.
people that are not named in any papers or anything, right? That don't have this recognition. You guys are just kind of like the who an example of this. There's so many people that have gotten to this from small roles to big roles, but it's that synergistic. The sum is more the whole is more some of the parts, and to the point of this is a constant evolution. And you
Mhm.
guys didn't give up, right? Because one of my clients, so I had a former student who was saying, she's like, well, I don't know how I'm going to compete people who have 3 years of experience or 5 years of experience. I'm like, the only way to get 3 years of experience is to not quit for 3 years. Like
Yeah.
they at one point only had 6 months of experience, also, right? Like same for me, same for medicine, right? Someone's first surgery at some point. So it's not just doing it,
Mhm.
but just our clients, it's a getting back up. The failure is we know it didn't work, right?
Mhm.
It's just consistently applying things. And I see this in kids, they just very naturally get back up and try again. Adults, we forget how long the process takes and oh, is it worth it? But we have that innately in us. And maybe speaking of this continued innovation, right, we kind of highlighted some of the awesome work, but we all have future visions and we're seeing far standing those shows of giants. I'm curious if you could maybe give us a little sneak of what are those things that you guys are thinking about for the future of coaching in the VA. Any things that you're thinking about implementing, or you can share with us if it's right for prime time, where this whole health is really moving forward from 2026 and beyond.
Mm.
Well, I think that one's a really exciting question. And what we're really focusing on right now is sustainment and integration, like we talked about already. We've had a whole lot of growth. We shared early in the podcast around 400,000 encounters in 2025, fiscal year 2025. So, and that's grown significantly over time. So we're looking right now around how do we keep this going? How do we support the workforce? How do we have clear expectations around performance, and how do we support competency and development over time? Some of the newer things that we're working on, we're integrating right now is what we call a well-being science tool. This is not only being integrated into health and wellness coaching, but in other elements of care across the VA. And it's really a brief, sort of simple resource that coaches can use to help veterans kind of reflect and check in on how they're doing across different areas of their life. It's not necessarily like a diagnostic tool or anything, but rather like a conversation starter. So we're supporting, coaches in utilizing that, documenting around that tool and having access to it. Um, we have ongoing work around supporting, lipid optimization in veterans, and really how do coaches have a role in that work, and what does that look like, and how can we scale that in different ways. We're also very much always focused around like that suicide prevention effort that is always at the forefront of everything we do in the VA. So integrating in concepts around coaching around suicidality, and supporting that hope aspect of life. And
Mhm.
um, so that's kind of where we are right now. Sustainment and integration; those are big focus areas. Really building and supporting that workforce, making sure that they have clear expectations around what their performance should be looking like, and we're having ways to kind of measure and track that over time. Because our goal is really to support them in doing their role as best as we can. Dr. Clark, what did I miss here? I feel like that was a quick high level summary.
No, I mean those are really some of our main points. I would say the other thing that we're looking to do is to continue to build connections between clinical areas. And I'll just use, so we have um, a phenomenal partnership with NBA. There's the pain management and the opioid safety folks, and so we have worked with them on a national, a regional, and a facility level. And because pain care has evolved so much to involve, to incorporate agency and functional goals and thinking about purpose. This has been such a natural partnership, and our colleagues in pain management have been uh, just amazing collaborators over the years. This is one place where we've been able to bring almost 30 coaches into pain management teams. And so one of the things that we've been doing is learning from that partnership how we can better support specific clinical entities that do require self-management. I mean, an example of that would be folks that are experiencing metabolic dysfunction. So how can coaches support folks that are experiencing metabolic associated, steatotic liver disease, and in the colloquial vernacular, we talk about, people call it fatty liver, right? But that's that's epidemic, right, in our country, for sure. And so thinking about how do we support metabolic challenges like metabolic syndrome and elevated blood sugars and diabetes. And so another aspect of our work going forward is to be identifying where are these clinical partnerships. We have many of them, but how do we grow them even more deeply so that we can ensure that there's a great understanding of a coach's work, so it's even easier to incorporate a coach's work into a clinical team, for a diabetes team, a pain management team, for folks that that have irritable bowel disease or mental health challenges. How do we partner so that we ensure coaches support not just these patients, veterans, clients, but also support these clinical teams with medically complex folks that they care for. So that's another thing that we'll be looking at in the future and focusing on.
Yeah, I love the bravery to take on big challenges, right? Because these are easy things to say, but mountains to move, but one shovel at a time, right? Keep the momentum going of what you've built. And as we close off here, we're asking the last few questions. I just want a few kind of comments from a live chat that I thought would be nice to bring in. One's from Daniel Abel. It says, as a veteran myself, we're typically well aware of what challenges we face transitioning back into society, yet rarely challenged to concentrate on what our assets are. Love this. Proper affirmation is transformative. So thank you, Daniel, for that comment, and thank you for your service, for Daniel and all the veterans that are listening. Another one as well, which might lead to my last question, from Michael Yatsko. Sorry if I'm mispronouncing that. He says, first, as a veteran, I want to thank you both for what you do. Second, if someone is interested in becoming a VA and health coach, is a specific resource center available to prepare for this position? As an NBC-HWC candidate, I'm very interested in learning more about it. Lastly, thank you to Salinas for hosting this. So I was going to ask, my last question here is, how can veterans access this healthcare and well-being services? How can people learn more about it, whether you're a veteran or a veteran and maybe a coach like Michael? Where can people find out more about the amazing work you're doing, either get these services themselves or become involved in some way?
Such a great question. And I think having veterans involved as health and wellness coaches in this system is so powerful, and something totally that we support. Like I alluded to earlier, we have the qualification standard now. So positions that are posted will be shared on usajobs.gov under health and wellness coach. And that would be the resource to look for any type of engagement with the VA and any application or jobs that might be available. Again, the required credential for full performance for a health and wellness coach is the NBC-HWC credential.
Mm-hmm.
And then for those who are veterans, maybe not looking for this, but looking to access themselves, where can veterans find out more about the health and well-being coaching services offered?
Yeah, just Google whole health. Whole health in Google, you'll find a landing page that brings you to the work of whole health, and health and wellness coach is sort of positioned right in there in the middle of whole health. I like to say the heartbeat of the whole health system, but that's my bias right there. And you can learn more about not only health and wellness coaching, but veteran groups that are available across the agency. You can also learn about the whole health partner role, which is really supportive in supporting veterans to navigate the system, which we know is a very complex system. And then you'll also see, other sort of resources and other bits of information about whole health across the VA.
The other thing too, I'll just note really quick is that as you're accessing care, so as you're talking to your primary care physician provider, and you can ask them, say, do we have a health and wellness coach in our facility? What Sara identified earlier, that we have 350 coaches in VA. And so that might mean that every facility would have a coach, but not necessarily. If there's about 140 facilities, in many facilities they have lots of coaches, and in some facilities fewer. And those shifts happen geographically for a number of reasons. But you can ask your care providers if you can be referred to health and wellness coaching. If your facility doesn't have a coach at this time, there's a mechanism to receive coaching virtually. So even if your facility at this time doesn't have a coach, there are mechanisms within geographic regions that you could have access to a coach in another facility. Maybe the facility that's 120 miles away, but because coaching can be so beautifully done in a virtual setting, there's a lot of capacity to receive coaching from a coach that's not necessarily in your geographic region. So that's something that we really want to make sure we're fostering for facilities that don't have a coach at this time. Of course, this role is growing, and so we're hoping that there will be many more coaches in the future. And again, we are so thrilled that that the VA has been on the cutting edge of this kind of innovation and person-centered care, that they've invested this effort into coaching. And so if this is something that's meaningful to you, this is something that you can share with your care team and share with your facility, because every facility is deeply, deeply, deeply invested in ensuring that they are providing you the kind of care that you envision.
Yeah, such a great point.
Yeah, well, and so all those veterans and coaches, you have resources to go to. For those, as everyone knows me, I love collaborating. If you cannot get help at VA, you're not a veteran, let me know. I'm working some also nonprofit work as well, so we can really make systems, no matter who you are, you get the support. I think the one thing we all have in common is we want to lower barriers to access and make coaching for everyone, not just for a few. No matter what you've done in the past, this is a very powerful force of transformation. So you have two awesome people here to collaborate with, and a third person here is always down to listen to ideas, make connections. I think we all three really do want to see how we can collaborate. We said this earlier before that we went live, actually. The collaboration, I think, is the next key thing to really spread awareness of this. And I really can't thank you and everyone in the VA, all those unnamed people, all these many decades that have got us to be at this point where coaching is becoming more standardized with supervision. The impact is measurable on a small and big scale, and really looking forward to kind of being that collaborative parallel effort to continue expanding this. So the next 10 years, we have a podcast again, we can say, wow, look how far it's come in this decade, right? If we do our things little by little, make that vector of change. So thank you, Sara. Thank you, Dr. Clark, so much for being this episode. Thank you for our listeners today, all those live questions, all the veterans, for all the work and services you've done. All of our doors are always open to collaborate, and I would love to have you guys back on again, maybe once you publish one of these new studies or any updates. You guys are always welcome here, and to spread the word of what you're doing. So thank you from the bottom of my heart for both of you and to our listeners, and we'll see you in a few weeks for our next episode. Take care, everyone.
Thank you, Dr. Smith, for all your time and support.
It's a real pleasure.